Hey friends, it's Natalie and welcome back to the podcast. I'm really glad you're here today. We're tackling a topic that I get asked about all the time, especially from women over 40, weight, hormones, and that tricky world of menopause and perimenopause. It's an area where many of us have questions, and I couldn't think of a better person to join me than Dr. Megan Garcia-Webb. Dr. Megan is not only a highly respected primary care physician, but also a certified life coach. She's spent over 15 years helping women navigate the complex changes that come with aging, weight management, and hormonal shifts. Her unique approach blends medical expertise with real-world lifestyle coaching. In our conversation, Dr. Megan shares everything you need to know about those weight loss medications that everyone seems to be talking about today. She explains how the medications actually work, who they're best suited for, and what you need to know about potential side effects. Most importantly, she emphasizes that these treatments are not a one-size-fits-all solution, but they are working for a lot of people. If you're considering these meds, you have to know about the lifestyle changes that are really necessary to see results. We're also going to talk about some of the latest research surrounding the medications and what's on the horizon in women's health. If you or someone you love has ever wondered about these medications, or if you just want to feel better and more empowered as you age, this episode is definitely for you. And before we jump in today, be sure you hit subscribe wherever you are listening or watching. And I have something new I want to tell you about. I've just released it. It's called the Gut Reset Plan. It is a free guide that you can get at natalietysdal.com/gut reset. It's to help you kickstart your journey to gut health, including practical tips and easy to follow steps. And again, you can get that at natalietysdal, that's TYSDAL.com/gut reset. All right, get ready for today's episode with Dr. Megan Garcia-Webb. Dr. Megan, thank you so much for taking the time today. This is one of the most popular topics and the one I get the most requests for.
Oh, great. Well, thank you so much for having me. I'm so excited to talk about it.
Well, you know, as women, especially women after 40, we face a lot of issues, weight being one of them, those with hormones and menopause, perimenopause, all of that. How did you end up in this space?
That is such a great question. Well, I have been in primary care for a long time and I love primary care. And of course, one of the big issues for people is their weight. And so it became very naturally an interest of mine because when you treat people's weight, you really are helping them fix so many problems at once. It's a really efficient way of taking care of people. So then from there, I got my obesity medicine board certification, my lifestyle medicine board certification. And then I still felt like there was a little something missing in terms of helping people go from where they wanted, from where they were to where they wanted to be. And I feel like the life coaching aspect really helps bridge that gap for me in my practice and something we don't do in medical school. So.
So when I read that about you and I follow you, I love that because so much of going to the doctor is about your life, about your lifestyle, about your mental state, about how you set goals and all of that. So I'm interested in that because you just said you don't get that in medical school. And how important is that in working with people?
I think it's so important. And, you have so much to cover in medical school that, you're still only scratching the surface of what you can learn at that time. So, of course, when you add things in like coaching, it's hard to squeeze everything in. But I do find that it is so important just talking with people because a lot of how we make change is our identity, what we believe is possible. And those are huge barriers for a lot of people. They just don't see themselves as a healthier version, or they think, well, other people can do that, but I don't think I can do it. So, and we tend to label ourselves with all these things like, well, I'm not a morning person, or I just don't like the gym, and all these beliefs that we have that are just thoughts that we can easily change.
Yeah, that is so true. And I hear people do that. I do a lot on mental health as well. I hear so many people say that's just not who I am. And we can change things in our lives if we are determined enough to do it.
Yes, absolutely. Absolutely. And we have to believe it.
You have to believe it. And you have to, sometimes it takes someone, life coach, someone else there beside you to help you see yourself the way they see you.
Yes, absolutely.
Let's talk about weight. So weight loss drugs, people know these types of, I guess if you want to call them peptides or drugs, whatever you have to tell us what you call them. They are becoming a household name, from Ozempic to Wegovy, tirzepatide, semaglutide. Tell me about what they are, how they're different, and your thoughts on them.
Absolutely. So we've had weight loss medications actually since 1950s when phentermine was first approved. So it's actually not a new category, but so we've had these oral medications, but the real breakthrough has been in the last 10 years when we realized that we could actually really effectively treat people for their weight with these injectable medications that were originally developed to treat diabetes. So the GLP-1 medications would include liraglutide, semaglutide, and tirzepatide. Those are just their generic names. And it's a little confusing because every drug has the generic name, the name for diabetes, and then the name for weight. But they really are a game changer because, number one, you could achieve so much more weight loss on average for people. So before we were only getting maybe 5%, 7% total body weight loss, on average. And then with these, you can get up to 20% total body weight loss. So really edging up towards, where we might get with bariatric surgery for people, which is really so compelling and amazing that we have these tools. And they also work in a different way than the other medications. So they work in your brain, but they also work on your GI tract to really help improve the signaling from your stomach to your brain. So they're so effective because they work in different ways, and the way that they work is so much more powerful.
So let's talk about the downside. We hear a lot of people have success with them, but with side effects. What are the most common side effects, and how can people avoid those?
Yes, that is a great question. So the most common side effects are usually gastrointestinally related. So I tell people the most common are these annoying but manageable side effects. So some people have nausea, constipation, diarrhea, vomiting, and then fatigue, like a low level of fatigue is very common for people as well.
Is that everyone, or is it because it's not being managed correctly?
It really depends on the person. I have some people that, they just get all the upside and none of the downside. And I have somebody like that pretty much every day. They're like, yep, everything's going great, no problem. So some people are just lucky. And then I think a lot of it has to do with you do need to be monitored carefully because, okay, if you have a little bit of constipation, it's not the biggest deal in the world. But if it's going on for a long time and you're not fixing it, then that can become a much bigger problem. That's when people read about these, the small bowel obstruction or the large bowel obstruction. These can be very serious medical issues. So the goal is always to manage them when they're small. And you can only do that if you're being watched, when you're being monitored by somebody.
Are there some people who should just not be taking these medications?
Yes, there definitely are. There's not a lot of contraindications for these medications, but there are certain types of, genetically predisposed thyroid cancers that, or cancer syndromes that, if the rare person who had that in their family or in their personal history, they should really avoid these medications. I think if somebody had, significant issues with pancreatitis, they're not a great fit. And then there are some eye complications that really wouldn't be a good fit for people, but these are pretty rare complications. And so it's very unusual that I find somebody that wouldn't be a good fit. I do find that, insurance tends to be the biggest side effect and complication for people.
And it is covered if someone, when is it covered by insurance? I guess I should ask that.
Well, it depends on the day, I feel like. It's always changing. And, some people have the same insurance forever and it was covered one year and now their insurance has decided they're not going to cover it or they're switching to a different medication. So for many people, it is covered by their commercial insurance. Unfortunately, Medicare really does not cover it. Although if people have other medical issues, such as, sleep apnea, moderate to severe sleep apnea, or some history of, heart attack, stroke, they will in those situations, but they're not covering it exclusively for weight. They're covering it to treat those other medical issues.
That's interesting. We talked a moment before we started recording it. I think it's important that we talk about who you're getting. If someone is going to go out and find any of these medications, they can get them in a lot of different places, from their primary care to a specialist, online even now. Why is it important that you're seeing the right person? And I want to talk about the management of the drug in particular, because what I have heard from many people is the side effects most often come when they're not seeing someone and managing how they're taking it and doing other things.
Yes, that is such a big, important thing to think about for people who are considering going on one of these medications. I think you really want to find somebody who's very comfortable prescribing them and comfortable monitoring them because they're so variable. It's not like it's that's what I've been surprised by is there are some medications where everybody's going to get this side effect and it's kind of a hard to tolerate for many people. And then there are some medications you feel pretty good about, like this is pretty easy for most people, but this class of medication is all over the board. So I think it's really important that you are seeing somebody who's used to knowing what can happen and knowing, how to prevent things from going from bad to worse. Some primary care doctors are very comfortable with that. And so if you have a primary care doctor like that, you're in luck. And I always just tell people, just check in with your doctor if you're interested about it, because you might be surprised. I think there are a lot who see this as a new way of practicing and have really incorporated it into their practice. And then there are some patients who come to me because they say, you know what, my primary care doctor doesn't really do this. And that's fine too. I always refer people to the American Board of Obesity Medicine because there's a directory there. You can search by your state. It's all people who have gotten done their boards in obesity medicine. So they should be very comfortable doing this if for some reason your primary care doctor doesn't. I worry sometimes. I have patients who come to me after they've gone to some of the telehealth places and they're all different. So I can't speak to, I'm not going to distinguish one from the other, but I do feel like there's some of them that it's like you texting to get your medication approved. And then there's very little questioning in terms of the safety or the candidacy for the medication. And then they're not really monitored. It's just kind of like, when do you want to go up on the medication? And it's very impersonal. And aside from that, just not being great care, it can be dangerous because I think, because we hear so much about these medications, I think sometimes we have a very casual attitude about them. Like, oh, just try it. Like, see what
Everybody's doing
happens.
it. Yeah.
Everybody's doing
Yeah.
it. Somebody in your family's definitely on this medication. Like all your coworkers are on it. Like it's everywhere, right? So I think we feel that familiarity makes us, maybe lowers our guard in terms of, being concerned about the medication. And, these aren't over-the-counter medications. They do need to be monitored. And while they're very safe and effective for a lot of people, you do really need to make sure that they're safe and effective for you. And the only way that's going to happen is if the person prescribing for you is checking in on you.
Yeah. I want to talk about, so the medications, many people, they're not hungry. That's why they're losing weight, right? Because they're not eating as much, slows down the digestive tract. But for someone who's not hungry and they're like, I can go until 1 o'clock in the afternoon, I don't even need to eat. I'm getting 1,000 calories a day. They're losing weight quickly, but that we know is dangerous.
Right.
Why is that? And so for people who are not being managed correctly, but they are losing the weight, why is it important to do certain things? And what are those certain things in terms of the amount you're eating and when?
Right. Well, I always tell people, we want you to lose weight, but we don't want you to be malnourished. So I think there are some people that find their appetite is extremely suppressed and they're really just having a couple of bites of food per day. So whenever I'm checking in with somebody, I'm always asking them, we're going through, what did you eat yesterday? Because I really want to know. And I tell them, like, I'm not the food police. Whatever it is fine. But I do want to make sure that you're eating because for some people, and especially in the early stages or if they're going up on the dose, they just find like, I don't have
Just
an
not
appetite.
hungry.
It's great.
Yeah.
I don't need to eat anything. And it's like, well, no, let's troubleshoot this.
Okay, so then let's talk about the working out. In addition, you're tired because you're not eating as much. So we kind of get
Right.
that cycle, right? You're not eating as much, you're losing weight, but you're tired, so you're not working out as much. What's the danger in that if you're not doing anything physically, working out, going on walks, lifting weights? Is that an important part of taking this medication?
Absolutely. I think there's a lot of in the media there's a lot about this, muscle wasting and concern about that.
Mm-hmm.
And certainly for me it's not something I see, in the clinic, but I do see people who are tired and they aren't working out. And especially for people who are in their 60s, 70s,
Mm.
it's a really helpful medication, but I want them to also not become more frail with the medication. So the working out is extremely important because every time we lose weight, a portion of that is collateral damage in terms of muscle. So you are losing a little bit of muscle and you want to be building that, preserving it, or even better
Mhm.
is to be building it. And so it is important for people to make a concerted effort. And a lot of times you get more energy too. So even though it might be hard in terms of starting, the payoff is really so helpful for people. And it's a good long-term investment.
So, eating regularly, not going long periods of time, getting the right amount of calories, doing physical activity along with it. What else would you say is important for people in managing the medication and lifestyle?
Yes. I think really one thing I think these medications do so well is teaching people how to listen to their body. And so I find that a lot of people, maybe they were really
Mm.
getting very sciency or kind of hyper focusing on macros and things like that. And now when they can actually hear that
Mm.
message from their stomach to their brain in a much stronger way, they can just rely on their internal cues now in a way that they really haven't been able to. So I think that's such a wonderful thing these medications do, but it is a little bit countercultural to how we live because everybody's eating in the car, eating on the
Mhm.
go. Like we're so distracted. I think a lot of times we don't feel like eating on its own is a worthwhile pursuit. We have to be doing something else. We have
We
to
have
be
to
multitasking.
multitask,
Right.
right?
So I
Yeah.
really like people to, number one, get used to relying on those internal cues more, but also, just having an undistracted meal,
Mm.
which sounds very simple, but it is so hard for people to do.
Yeah, in our busy
Yeah.
lifestyle that is
Yeah.
so we eat at our desk, we like you said,
Right.
eat in the car. It's tough. There's so much to do.
There's so much to do, but I always tell people, whatever you're doing while you're having your meal, by definition, cannot be that important.
Yeah.
Because if you had a big meeting, if you were, closing on a deal, if you're giving a presentation, if you're performing surgery, you're not eating in
It's
any
so
of those
true.
tasks, right? So whatever you think you can squeeze in while you're eating is just by definition not, it can wait, 10 or
Yeah.
15 minutes.
Yeah, that's so important. People who are taking the medication for other reasons, what are you seeing? I'm hearing a lot about the anti-inflammatory qualities of the medication, microdosing versus going up and up until you're losing all the weight you want. Talk about that a little bit.
Sure. I think there really is, especially in the space of addiction. I think
Mm.
that's where I would hope that we would, once the medications are more broadly available and can be potentially prescribed off label, because we don't really have the supply or the
Mm.
cost in any sort of place where we could do that on a large scale yet. But I do really think that in terms of addictive behaviors and alcohol in particular, that there will be a really significant place for these medications. And so there might be people who in the future, they really aren't taking it for their weight, but they're just taking a low dose to help with their sobriety, which I think, can also be life changing for people. And then in terms of the anti-inflammatory effect, we know now that fatty tissue is essentially its own endocrine organ. And when we have too much of it, it's really giving off these inflammatory signals. So when we lose weight, we're essentially decreasing the size of that. So there are people who, in addition to having more weight than they wanted, they have other things like rheumatoid arthritis, psoriatic arthritis, so many different autoimmune issues. And I think we're still so much at the beginning phase of learning about what these medications can do, but that is one area where I think it could be very promising as well. But we don't really have the logistics figured out to be able to explore that yet.
But it's fascinating to think of how it could change lives in that way. What about going off of it? Is it once someone starts, they start feeling good? Have you seen people successfully go down in dosage and eventually go off of it, or are they needing to stay on it?
I have not, but I'm also not trying that with people. I mean, sometimes that happens because people lose lose insurance coverage, or, they transition from commercial insurance to Medicare and then it's no longer covered. And I cannot think of one person who did not gain the weight back. And even if they're doing all the same things. And that is also what the research shows, is that when people go off, it's not the first day or the first week necessarily, but the weight does tend to go back on. And I think a lot of that has to do with how the medications really reset things in the brain to make it easier for people to lose that weight. And then if you take that away, it just kind of goes back to where it was.
And they're just hungrier, so therefore they're eating more?
Hungrier, but also, there's a reason why somebody is a certain height, has a certain shoe size, has a certain, there's all these little parameters that are specific to our body, and that includes our weight. And part of how we think these medications work is in the brain, in our hypothalamus, it's really changing where that natural weight point is for people. And so even if people are doing all the right things, I'm never surprised if the weight comes back on, and it's really no fault of that person, but it's just their set point essentially goes back to where it was.
Yeah. So most people are going to need to continue to take it and be okay with
Right.
taking it forever.
Right. And of course, this is just at the beginning of this branch of medicine. So I also tell people, yes, you want to be committed to be doing this forever, but also who knows what we'll have in 5 years, 10 years, we'll have different protocols. We'll probably have figured a lot of other things out. There'll be other medications. I think the goal of every pharmaceutical company now is to make something that people can take, every 6 months or once a year. So there will be new things coming out, but for now, this is the best plan we have to keep people healthy.
Yeah, well, it's fascinating, and we've seen so much success and people are so happy about it. So it's fun to watch as it develops, to be in such a space where we can see people so successful with it. Anything else that you'd like to talk about regarding the precautions or just the industry in general?
I just think it's really okay for people to look around and ask people, how comfortable they are if they're talking to somebody who might be prescribing the medication. What's the follow-up plan? What are your certifications? How much experience do you have doing this? Because there are so many people who are getting board certified all the time that I think there's going to be no shortage of people. And so I think it's important for patients to make informed decisions, but also to know, like, you're not offending anybody, or you shouldn't be offending anybody if you just ask what the plan is. And if you can't ask what the plan is, if it's all being done through like an app or texting, that's a big red flag for me.
Red flag for sure. Yeah, to find someone to walk with you through this, because the side effects alone, they can be difficult if they're not managed and you don't have someone that you can really work through these things with. Yeah. Well, Dr. Megan, thank you so much for your time. I know you're on YouTube, but where can people find you and learn more from you?
Absolutely. So my website is www.weightmediциnemd.com. If you want to learn more about how to work with me, I work with people around the world, helping them with the non-medical aspects of their weight loss as well as a life coach. And then my YouTube channel is Weight Medicine with Dr. Megan. And I'm excited to keep helping people.
Super. Thanks so much for joining me.
Thank you.